Hey, good morning. I want to thank everyone for being here today. We know we must tackle the epidemic of drug overdose in San Diego County. We have to act to save lives, offering a path to treatment, restoration, and healing. A multi-decade criminalization and war on drugs from a law enforcement standpoint have been an abysmal failure. And we have to fundamentally rethink our approach. We must change what we do if we want to get better outcomes. When I came in as a supervisor, I talked a lot about the need to adopt comprehensive harm reduction strategies, about the need to promote treatment, about the need to understand the nature of addiction and view it for what it is, as an illness, as something we need to treat, as something that we need to show compassion and empathy and love towards those who are struggling from substance abuse. And doing this is not only the morally right, humane thing to do, doing this will get us better outcomes. It will save lives. It will restore families. It will ensure people have an opportunity to live a full and productive life. But doing that requires a change. It requires us to do things differently than how we have done them in the past. And this board of supervisors in this county are moving aggressively in that direction, starting earlier this year when we adopted a comprehensive harm reduction strategy, embracing things they would never even talk about for decades, things we know work, like syringe services. It comes from tackling our criminal justice system, working with the sheriff. We've made a significant transition, and this year's budget includes 141 clinicians to work in our jails. Clinicians to provide medication for addiction treatment, to provide connections to ongoing help and services. And today, what we are doing today is another powerful and strong step forward. We are here today because the County of San Diego will soon make Naloxone, an overdose reversal medication, widely available at multiple community-based locations and clinics throughout our region. In 2020, San Diego County recorded 457 fentanyl-related overdose deaths, a 200% increase in 1 year, from 151 recorded deaths in 2019. Now, we know overdose deaths have been increasing systemically over the course of the last decade. But what we have experienced in the previous 24 months, along with finally having a board of supervisors that will support these efforts, have brought us here today. When I first came to the board, I tried to introduce a comprehensive harm reduction strategy. We didn't have a board that would support it because holding to an old model and an old way of thinking was too ingrained. But now we have a new board that is willing to go in a new direction, and San Diego County will be better because of it. Increasing community distribution of life-saving medication is one component of a lot of the efforts that we've talked about. It is time in San Diego County that we rise to meet the challenge that we face today. It is time for us to confront stigma, to confront old ideology. It is time for us to acknowledge what did not work and to embrace what we know will work. And that is a part of what we are doing in rebuilding our behavioral health system and rebuilding our approach to substance abuse issues. Using Naloxone on overdose patients is a medically supported harm reduction best practice, and today we are taking a significant step forward to make sure it is more widely available. I want to thank Dr. Wilma Wooten, our public health officer, who will be signing the standing order on Naloxone distribution today. I want to thank Dr. Luke Bergman, our Director of Behavioral Health Services. I want to thank Tara, who is here, and the Harm Reduction Coalition of San Diego County. And everyone who's joined us here today as a part of this coalition feels a great sense of urgency. And we feel that because of what we see. I would say that there are very few individuals in San Diego County who have not had their life touched in some way by substance abuse. A friend, a family member, a fellow veteran. So many in San Diego County have had this impact them directly or indirectly, and we owe it to all of them to be here today, to have this sense of obligation drive us into action and drive us to do more. I want to now transition to a couple of the individuals we are going to hear from today to share their perspectives. First up will be Dr. Luke Bergman, our Director of Behavioral Health Services. We have been working side by side for 2 years and 6 months to design the system, to build a better way for behavioral health services. And I appreciate Dr. Bergman's thoughtfulness. I appreciate his desire and drive to move, and I appreciate his great patience with a often impatient county supervisor who not only wants everything to change, but wants it to change, damn it, right now. And the understanding that it can't always change right now. Some of these things take a little bit of time. And I appreciate tremendously the work Dr. Bergman is doing for our county.